Hello everyone, my name is Haydee Dodd and I am owner and broker of 903 Insurance Services, where we specialize in Medicare, health, and life insurance. Today's mission is to clarify and simplify your Medicare solution process. Medicare Made Simple is brought to you by 903 Insurance Services. Today I'm here to help you understand your Medicare benefits and your insurance options. Welcome, my name is Haydee Dodd and I'm a licensed insurance broker. Here at 903 Insurance Services, we offer free, no-obligation Medicare education and guidance, up-to-date information about healthcare network changes that impact access to your trusted providers, annual review of plan benefits and options during the Medicare annual enrollment period, and partial Medicare plan comparisons for the plans that we represent. Signing up for Medicare. If you receive benefits from Social Security or the Railroad Retirement Board and are turning 65, are under 65 and disabled, or have ALS, you will be enrolled in Medicare's Part A and B automatically. You will receive a red, white, and blue card in the mail 3 months before your 65th birthday or on the 25th month of disability benefits. If you are close to 65 and do not receive Social Security or Railroad benefits, you must contact Social Security 3 months before your 65th birthday. You can choose not to keep Part B when automatically enrolled. If you change your mind, you may be required to wait on enrolling and pay a penalty for the duration that you have Part B. If you do not sign up for Part B when first eligible, your Part B premiums may go up 10% for each 12 full month period that you could have had Part B and didn't sign up. If you or your spouse are still working and you have health coverage through an employer or union, you may delay Part B premiums without penalty. Please take note that coverage based on current employment does not include COBRA, retiree coverage, VA coverage, or individual health coverage through the health insurance marketplace. Medicare's Part A and B. Medicare Part A covers 80% of your hospital coverage. Part B covers 80% of your medical coverage. Together, they equal original Medicare. Medicare Part A covers your hospitalization, semi-private room and board, general nursing, and miscellaneous services and supplies. The first 60 days are covered at 100%, minus a $1,632 deductible. Days 61 through 90 is a $408 copay per day. Days 91 through 150, while using your 60 lifetime reserve days, has a copay of $816 per day. Skilled nursing facility requires 3 days hospital stay. The first 20 days are covered at 100%. Days 21 through 100 have a $204 copay per day. Days 101 and above are not covered. Home health care. It is covered under Medicare approved services at 100%, only for medically necessary skilled care services and medical supplies. This is not long-term care. Medicare Part B covers your medical expenses in or out of the hospital and outpatient hospital treatment such as physician services and supplies, physical and speech therapy, diagnostic tests, and durable medical equipment. There is a Part B premium that you must pay every month. For 2024, it is $174.70. Please take note that if you are a high-income earner, there may be a surcharge and you may pay a higher premium. Medicare Part B also has a yearly deductible that Medicare sets. For 2024, that deductible is $240. After the deductible is met, Part B generally covers 80% of Medicare-approved amounts. Some preventative care is also covered under your Medicare Part B. Let's talk about what is not covered. Original Medicare does not cover deductibles and coinsurance, prescription drugs, preventative dental benefits, routine eye exam or eyewear, and it does not have an out-of-pocket maximum. There are 2 paths to choose when looking at your Medicare options. Path number 1 is you keep original Medicare. You may add on a prescription drug plan to cover your drugs and or a Medigap plan. The other option is a Medicare Advantage plan, otherwise known as a Part C, that combines Part A, Part D, and usually Part D. You may also have the option to add just a standalone prescription drug coverage. Let's talk about the differences. Medicare Supplement, otherwise known as a Medigap, versus Medicare Advantage. Physician and hospital. With a Medicare Supplement, you can choose your own doctor and hospital. They must be Medicare approved and accept Medicare patients. With a Medicare Advantage plan, you can choose any doctor, but the Medicare Advantage plan requires the use of plan networks. So the doctor must be within the plan's network. For referrals, on a Medicare Supplement, no referrals are necessary. On a Medicare Advantage plan, referrals may be required before seeing specialists. Prescriptions. Medicare supplements do not cover prescription drugs. You may add an additional Part D for an additional cost. On a Medicare Advantage plan, prescription drugs or coverage is included in all Medicare Advantage prescription drug plans, otherwise known as MAPD. The travel. With a Medicare supplement, there are no network restrictions. Your coverage travels with you across the United States, so as long as they accept Medicare. On a Medicare Advantage plan, there are PPOs and HMOs, which include networks. Travel emergency care is always covered when traveling. Enrollment. If you're enrolling into a Medicare supplement, there may be other opportunities to enroll without medical underwriting depending on the state, but generally, you may be subject to medical underwriting. With a Medicare Advantage plan, there's a 7-month initial enrollment period, which is 3 months before, the month of, and 3 months after your 65th birthday. The cost. On a Medicare supplement, you must continue to pay the Part B premium and the Medigap monthly premium. Your out-of-pocket costs are very limited. Don't forget, you must purchase a separate prescription drug plan. With a Medicare Advantage, you must continue to pay the Part B premium and the plan's monthly premium. Whenever you access healthcare services, you're generally required to pay co-payments, co-insurance, and or deductibles. Medicare Supplement. You may add a Medicare supplement to your original Medicare. Unless you're new to Medicare, supplements plans may require health statement underwriting or medical questions. You must have Part A and Part B and continue to pay the Part B premium. Plans designs range from A through N. Plans are standardized. A Plan G is the same regardless of the insurance company. Only plan premiums may vary. Medicare Part D. Prescription drug coverage is not included in plans sold after January 1st of 2006. Medicare pays first for Medicare eligible services, then the Medicare supplement pays next for some or all of the patient's portion. Medicare supplement plans may also include some benefits not covered by original Medicare. This, for example, is foreign travel. However, they do have limitations. Let's talk about Part D, Standard Prescription Drug Plan. These plans are offered by private insurance companies and must meet or exceed the minimum standard plan. They're available to anyone who is enrolled in Medicare Part A or Part B or both Part A and B. These are provided by private insurance companies. Monthly plan premiums vary. You are only allowed to have one Part D at a time. If you do not enroll when you're first eligible, you will pay a penalty of 1% for every month that you did not enroll. Just like Part B, premiums could be subject to an income-based premium surcharge. There are programs like Extra Help or Low Income Subsidy, LIS, which are Medicare programs that help people with limited income and resources pay for Medicare prescription drug costs. The late enrollment penalty is 1% per month multiplied by the national base beneficiary premium, rounded to the nearest 10 cents and added to your monthly premium. Please take note that this penalty, as of 2024, is for life. Part D continued. Formulary. Each Medicare Part D prescription drug plan has its own list of covered prescription drugs. These prescription drugs are placed into different tiers, representing different costs. For instance, Tier 1, preferred generic. Tier 2, non-preferred generic. Tier 3, preferred brand name. Tier 4, non-preferred brand name. Tier 5, a specialty tier. The higher the tier, the more expensive the prescription drug. Prior authorization. The plan you enroll in may require prior authorization for certain medications. Step therapy. Your prescription drug plan may require you first try certain less expensive medications that have had been approved for most people with your condition before you can move up a step to a more expensive prescription drug. If you have already tried the similar less expensive prescription drug and it didn't work, your prescriber can contact the plan to ask for an exemption. If approved, your plan will cover the step therapy prescription drug. How it works. There are 4 stages to the Part D plans. The first stage is the deductible stage, where you pay $0 to $45 depending on your plan. The second stage is the initial coverage stage, where you pay your copays based on the tier of medications. Once you have paid $5,030 in the initial coverage limit, you would fall into what's called the coverage gap, where you pay 25% of the cost of generic prescription drugs and 25% of most brand name drugs until you reach the out-of-pocket limit of $8,000. Then you would fall into the catastrophic stage and you would pay $0 for covered drugs for the remainder of the year. The total out-of-pocket costs are the amounts paid by you in the first 2 stages, plus any applicable drug manufacturer discounts applied in the coverage gap stage. Medicare rates Medicare Advantage and Medicare Part D prescription drug plans from 1 to 5 stars. So 1 is poor, 2 is below average, 3 is average, 4 is above average, and 5 is excellent. Enrollment in plans with below average or poor rating is discouraged by Medicare. If you do enroll in one of these plans and want to change, contact Medicare at 1-800-MEDICARE for assistance. Part C and D Medicare enrollment periods. The initial enrollment period, also known as IEP, this is the time frame most people sign up for Medicare. A 7-month period starting 3 months before your 65th birthday, the month of your 65th birthday, and ending 3 months after your 65th birthday, assuming you do not delay Part B benefits. There's also the Medicare annual enrollment period, which is between October 15th and December 7th, where beneficiaries may switch plans or add or delete Medicare Part D prescription drug coverage. New plans will be effective January 1st of the following year. Guidelines apply. Medicare open enrollment is January 1st through March 31st, where Medicare Advantage plan enrollees may enroll in another Medicare Advantage plan or disenroll from the Medicare Advantage plan and return to original Medicare. Individuals may make only one election during this period. There are also special enrollment periods throughout the year that may apply for change of residence, loss of group coverage, or if your plan withdraws from the marketplace for the upcoming year. Let's talk about what's new and important for 2024. They have lowered the cost of insulin in 2024. Your Medicare drug plan cannot charge you more than $35 for a 1-month supply of each insulin product Part D covers, and you do not have to pay the deductible for it. If you take insulin through a traditional pump that is covered under Medicare's durable medical equipment benefit, that insulin is covered under Medicare Part B. You won't pay more than $35 a month for supplies, and Medicare deductible no longer applies. Managing and treating chronic pain. In 2024, Medicare will now cover monthly services to treat chronic pain if you have been living with it for more than 3 months. Better mental health care. Medicare will cover intensive outpatient program services provided by hospitals, community mental health centers, and other locations if you need mental health care in 2024. Shots or vaccines. Recommended adult vaccines are also now available at no cost to you. Part B covers flu, hepatitis B, and COVID-19 shots and vaccines. Part D generally covers all other recommended adult immunizations like shingles, tetanus, and diphtheria to prevent illness. In 2024, you can get more vaccines under Part D at no cost to you. Contact your plan for details and talk to your provider about which ones are right for you. It's important to know that there is no one plan that is right for everyone. Keep the following in mind as you compare your Medicare plans in search of your Medicare solution. Is this plan accepted by your physician and hospital? Does the plan of choice provide the right balance in monthly plan premium and cost sharing? Are your medications covered at the most affordable cost? Does the plan meet your travel preferences and lifestyles? When you're ready to select plans, we're here to help. Here are a few tips. Make a list of your physicians and hospitals to verify they are in-network if you're comparing Medicare Advantage plans. Make a list of your medications, including dosage. Make sure your plan of choice includes all of your prescription drugs. If you're doing your own research, make a list of any Medicare plans of interest along with any questions you have. Call 903-666-5136 or visit www.903insurance services to schedule your appointment with a licensed insurance agent that specializes in Medicare. Here's some information for some of our sources. Thank you for taking the time out of your day to attend our presentation. If you have any questions, please contact us at the information.
Thank you for joining us today for our Medicare Made Simple seminar. Since you are Medicare ready, please visit our website at www.903insuranceservices.com. Click on the right hand button that says schedule an appointment. Hope to see you soon. Thank you.